Rhode Island enters the next phase of its vaccination plan. One of the groups included in it are pregnant women who are classified as having an underlying medical condition. 12 News reporter Courtney Carter spoke with a local maternal health expert about what they say pregnant women should do.
With just a few days to go until pregnant women in the Ocean State are eligible for a vaccine, I spoke to experts about whether they should get it or hold off. The CDC says pregnant women have an increased risk of getting severe COVID-19, but the World Health Organization says there isn't enough data on the vaccine in pregnant women to recommend it at this time. So what should pregnant women do? The World Health Organization does add if a pregnant woman has an unavoidable high risk of exposure, like if they are a healthcare worker or first responder, then vaccination may be considered. Dr. Erica Werner, director of the Maternal Fetal Medicine Program at Women and Infants, says she is on the same page.
We don't know about the long-term effects of COVID-19 on the fetus. Pregnant women were excluded from the vaccine trials. So I think where that leaves me is really having a discussion with each patient about what their risk is of getting COVID. And I think for a lot of people, it makes sense to go ahead and get the vaccine.
Dr. Elizabeth Burchard, a physician at the Center for OBGYN in Providence, agrees.
The American College of OBGYN and the Society for Maternal Fetal Medicine have actually both put out a policy statement, which is very easy to access online for patients, that essentially says that although, yes, there may be some small unknown risk with the vaccine, we still strongly feel that the overall benefit of getting vaccinated outweighs the potential risk.
If you really are able to isolate at home, then by all means, it makes more sense to wait until we have more data. But for most people, that's not possible. And for those people, I think they really need to talk to their doctors and think about getting the vaccine.
When it comes to breastfeeding women, the World Health Organization says if that woman is a part of a group recommended for vaccination, then it can be offered. I'm Courtney Carter, 12 News.
Thank you, Courtney. And just a short time ago, the World Health Organization changed its guidance for pregnant women considering a COVID-19 vaccine, now saying it is safe. In a revision on their website, they say we don't have any specific reason to believe there will be risks that would outweigh the benefits.